Hello everyone and welcome back to episode 4, part 2, or episode 4 of the Body Wisdom series, but part 2 on the topic of cancer. I've got the lovely Jodie here with me again, and Jodie's going to introduce our special guest today. We're very excited about this. Now, Jodie, quickly introduce Emma for us, please.
Okay, so today we're lucky enough, and Sonja and I are both super excited to introduce you to Emma Park, who is a fabulous and fantastic functional nutritionist and a health professional educator. And Em specializes in gut microbiome and gut health and how that affects our overall health and wellness. And she is also the founder of the newly launched the First 1000 Days program, which is a brilliant program Emma has put together for new mums, and to teach them about the importance of microbiome for the first 1000 days of a child's life, so from conception until they're 2 years old. So welcome, Em.
Thank you.
Thanks. Now, before we get going, I just want to quickly recap for people that last week we covered in episode 1 what cancer is in terms of the 6 root stresses and causes, and how it's an adaptive process that occurs in the body, that we don't need to be afraid of it, that when we're educated and understand it, we're far better chance of being able to treat it holistically and effectively. So today's episode is particularly focused on the lifestyle aspect of cancer treatment, and understanding how lifestyle and nutrition has an impact on what's happening for you in terms of cancer, and either having cancer or your ability to overcome it. Do you want to add anything else to that, Jodie? Because I've forgotten already what I was going to say.
No, that was great.
Okay, perfect. So you've got the first question for Emma. This is going to be an incredibly interesting webinar. Super excited.
Well, Sonja and I are also really excited to learn here too, because Emma's the specialist in this area, so we're going to learn too. Yeah. So I guess, Em, the first question we're really interested in knowing is, how would you describe what the microbiome is and its role for us?
Sure. So are you getting that feedback? Or
yeah, I can hear it. Yeah.
Do I need to do something, or is it gone away now? I feel like it's gone away.
It's gone away now.
Okay, great. So, sorry, love the tech glitches that happen when we do these things.
That's okay. We keep it real.
Yeah. So the microbiome is the term that describes all of the microbes that live in and on us. We discovered it, and also the microbiome is the genetic material of those microbes as well. So we discovered it when we were sequencing the human genome. And we found all this, DNA fragments of material that wasn't human. And then we discovered, that we have all this, this material living in and on us. And the greatest concentration is in the gut. It's mostly bacteria, but there's also viruses and parasites and yeasts and funguses and all of these other bits and pieces as well. And they all have a role to play in the health and function of that body site. And every body site's got its own microbiome, but some have got greater concentrations that, as far as we know, are having more influence over the health and function of that body site. So the gut's a really good example of that. It's really closely related to the health and function of the gut and the immune system, so that we know that 70% of the immune system is in the lining of the gut. Some of the other body sites, the oral, we've got the big concentrations in the mouth, the oral microbiome, and that's very relative to cardiovascular and vascular health, which is really amazing. The reproductive organs have got their own microbiome, the skin, the respiratory system. So yeah, it's pretty amazing.
Amazing. It's everywhere. And even those words, I guess, that we hear of, the parasites and the yeasts and, they're our biological helpers, right?
Yeah.
So they're not always a bad thing. And that's where Sonja and I come from a mental health perspective, or lifestyle prescriptions and biocompass, is we need the microbes in their body, that they're actually biological helpers and they've got a purpose.
Absolutely.
They've got a purpose.
Yeah, and they interact with the host, and essentially we are the host. There's more microbes and DNA material than there is human cells. So greatly outweighed by the microbial genetic material.
That's amazing.
So we are a host.
Yeah,
to the
wow.
microbiome. And it's new science. The more we're learning about it, the more we understand the role of that microbiome. So it's closely, in the gut, it does things like making nutrients and looking after the gut lining. It interacts with that host immune system, with the gut-brain axis. It makes neurotransmitters like things like serotonin and GABA, and so the bugs actually make these little molecules that are then used by the human body as signaling molecules or inflammatory molecules or anti-inflammatory. So it's super important that we have this healthy balance. And what we're seeing in our current populations is a real loss of that diversity of our microbiomes. Yeah.
What do you think the reason for that is? Is that being over sanitary, or is it not feeding the gut?
Yeah, that's one of them. A modern lifestyle has a lot of components that impact the microbiome. Stress is a massive one. So there's a direct correlation between the gut and the brain, and stress response drives inflammation in the gut. And, and then that changes the environment of the ecosystem in the gut, and then that will change which bugs are either growing or not. And then that works in the opposite way as well. So stress will impact the environment of the gut and impact which bugs are thriving or surviving. And then once there's an inflammatory response in the gut, that's going to drive inflammation back to the brain and also disrupt the brain chemistry, and then stress coping mechanisms and mood and those kind of things as well. So it's a two-way street, that gut-brain axis. Most of the information is going this way. 70% of the information is actually going from the gut to the brain. So it's like it's a sensory organ that's giving information to the brain about the environment of the body.
Amazing. It works so closely too with what Sonja and I teach from emotions, because emotions really affect the stress response both ways as well. They feed each other. Sonja, did you have anything, honey?
No, I'm just a little bit mind blown right now. It's got my little cogs are going, because I'm realizing just how significant this is. So if we were to tie this in then to understanding the impact for people, because we're specifically obviously talking about cancer in this at the moment. And so in terms of either relation to causes of cancer or your ability to heal, it would be really good for you to explain to us how significant this is in those processes.
Yeah, so there's essentially three main roles of the microbiome to do with cancer. One is that integrity of the lining of the gut and the relationship with the immune response, because obviously that's huge in cancer. It's a dysregulated immune response. Two is the level of inflammation. So the microbiome is very closely related to what's going on in that level of inflammation, as far as if there's dysbiosis, which is the imbalance in the microbiome, we've got an overgrowth of pathogens or a loss of beneficial bacteria, then our inflammatory markers are up. They actually make a molecule called LPS. You might have heard of this, the lipopolysaccharide. It's actually in the cell wall of the bacteria. Certain bacteria make this molecule, and it's very inflammatory for the human. So we've got an overgrowth in that bacteria, then we're going to have a higher inflammatory drive going on, and we call it the endotoxin load. So you would have guys know about this, so that that you get this increased endotoxic load. And that's going to really drive that capacity to deal with the cancer, the immune response, and that level of inflammation. And then the third one is the health of the microbiome and the bowel, as far as eliminating toxins and waste, and how important it is to have healthy elimination. So some of the main things that are driving the dysbiosis and the disruption to the microbiome are the same things that are driving cancers, like environmental toxins, stress, medications and side effects of that, poor diet, high sugar, like all of these kind of things, BPAs, hormone disruptors. So the other, I should have put 4 things. So the other role of the microbiome is helping with hormone modulation as well. So we know that a lot of our cancers are from, driven by excess hormones or imbalanced hormones as well. So, thyroid and estrogen cancers and stuff like that. So there's another major role for the microbiome as well. So it's we call the that there's an estrobiome. So it's the actual part of the microbiome that's involved in estrogen metabolism. So actually making estrogen, but also detoxifying and getting rid of excessive
Wow.
estrogen as well.
Yeah. So then I guess just like in a really sort of simple way, with you know, you've got causative, but then also solution-based, you know, focuses with the gut microbiome. What on a really basic level, from a preventative point of view, what could people be doing straight away after watching this video to help support their microbiome straight away, knowing how, I mean, obviously stress, and we talk about this all the time, stress reduction is so vital just as a day-to-day functioning, but from a practical aspect, what else could people do to now start to support, like even what foods, what, you know,
absolutely,
medication,
well,
supplements?
Food's the biggest thing. So food is by far the biggest intervention we have over our microbiome. The plant-based food group is what has most influence over our microbiome. So that's, you would have heard of the probiotics and the prebiotics. So the probiotics are actually the live bacteria, and we have our own indigenous flora, and then we have like supplemental probiotics which come in the form of food or, you know, supplements that you can buy. But the prebiotics are the things that actually feed those live bacteria. So, you know, we used to think when we'd have a course of antibiotics and we know that wipes out all of the bugs, the good and the bad guys, we could take a course of probiotics and that would reseed the gut. So they don't actually work like that. They don't reseed. They look after the environment, and they're very beneficial in a transient way, but it's the prebiotics that actually really feed up and restore our indigenous flora. So they're really important, and that's in our plant foods and our fibre. So fruits, vegetables, you know, other plant foods, nuts, seeds, herbs and spices, all of those things. And the diversity in that group of foods is what creates a good, diverse microbiome. So we don't tend to have a very diverse plant-based diet anymore, which is what we used to have. Like, you know, traditional diets were very plant-based. We looked at hunter-gatherer, it was, you know, seasonal, and they've done the Human Gut Project where they sampled everybody's stools from all over the world, and the Hadza tribe in Africa had the most diverse microbiome left. They still live very traditionally. They don't have any medications. They, you know, eat a traditional diet, you know, not taking antibiotics. They breastfeed. They, you know, they don't go into hospital to have babies.
No GMOs.
No, any of those things, you know, like, so they just really have that really diverse plant-based diet. They get most of their food, most of their energy from 80% from plants, and we tend to not do that anymore in our Western diet. So our Western affluent countries have got the worst microbiomes as far as diversity. It's like it's been described as mass extinction.
Wow.
Yeah, as like, you know, we can align it with what's happening on a global scale as far as, you know, our species richness with animals and trees and plants and that kind of thing is pretty much what's happening in our gut. So antibiotics have got a big part of it. It's definitely something that's had the biggest impact. We didn't realise what we were doing by, you know, blanketing everyone with antibiotics in childbirth and for any tiny little ailment or any infection. You know, it really have had a massive impact on that, you know, overuse of antibiotics. Yeah.
What about supplements then?
So there's some great probiotics. So probiotics is one of my passions, and I know a lot about it. I work for a small Australian probiotic company, so I have to know a lot about it. And it's really changed a lot in the last kind of 10 years. Like I said, 10 years ago, we thought we could take a multi-strain probiotic and that would fix all our problems after an antibiotic, but they don't actually work like that. But they do have a very great, I explain them like a gardener. You know, we used to think they were the garden seed, but they're actually the gardener. They're tending to the environment and having a beneficial effect, and then we're using the prebiotics to feed them up. But particularly for like cancer patients, you know, in a prevention role, they've got it's definitely, you know, that diet has the biggest impact over the long-term health and function of the microbiome. But in that short-term role, probiotics are really great medicine. They're really amazing if you get a good quality, but they're not all the same. The cheap stuff that you buy at the supermarket just doesn't, they're not viable. They don't have good strains in there. We need the good strains that we know have all of these mechanisms. So a good probiotic is really anti-inflammatory. It'll bring down those pathogen loads. Like it can actually, it works like a selective antibiotic. It will take out the pathogens and support the growth of your good bugs. really anti-inflammatory, helps to restore the mucous membrane lining, helps to make things like secretory IgA in that mucous membrane lining and glutathione. So antioxidants, anti-inflammatory, helps with that, the integrity of the mucous membrane lining, helps to modulate immune response. So they have some pretty amazing mechanisms as far as medicine. So yeah, they're an awesome one to use for either in a preventative role, but also acutely when you're going through chemo, because everyone knows that one of the gut is one of the most impacted organs when you're going through chemo. Yeah. Rapidly turning over cells, and probiotics have an amazing protective effect through that. We've had plenty of cases of people going through chemo that have been able to really reduce that side effect to the gut.
Just so important to, after treatment like chemo, to rebuild your immune system. So, the body really can recover.
Really big part of that. And probiotics are great at the gardener. The prebiotics from a plant-based diverse diet. There's also some specific prebiotic supplements that can be really beneficial as well. Like I tend to see a lot of clients that have really bad gut issues, so like really long-term digestive issues, food intolerances and stuff like that, where they're on a really limited diet, they've done that, had to eliminate lots of food. And so I definitely work on building up that integrity of the gut before we can include a lot of those diverse foods in. So for people like that, specific prebiotic supplements are great as well, so they can really sort of help restore the good bacteria when you don't have the capacity to have a diverse plant-based diet. For some people are like that. There's a lot of people in our communities with intolerances to groups of foods, like your FODMAP people and your fructose people. You would have heard of them. I get a lot of clients like that are on really limited, and a lot of them are plant foods. They're reacting to histamines and salicylates and all of these lectins and things that are in plant foods. And I often will say to people, it's not the food's fault. It's what potentially what we do to food. So food's not food anymore, we know that. And so again, that's that having a healthy microbiome diet looks like knowing where your food came from, buying locally, buying seasonally, those kind of things as well, organic where you can. Obviously we can't all afford that or even access it, but it's one of the things I say to people as a great addition is herbs. We can all grow herbs in our backyard or in our pot, or you don't need a lot of space. Really medicinal and awesome to add into your diet and easy to do, and anyone can include that. So that's one of my favourite. Nuts, seeds, herbs and spices are my 4 favourite, because you can pretty much add it to what you're already eating. Sometimes people going through cancer would find it really difficult to overhaul their whole diet. Hopefully they've been given the advice to, take out processed carbohydrates and sugars, because we know that those kind of things really feed cancer cells. We know that cancer cells have got 16 times more insulin receptors on the cell wall than non-cancer cells. So we've got that. We know that, and I think Sonja, you were saying before that sometimes people get told diet isn't important if they've got a cancer.
I've heard it.
Yeah, I've heard it
firsthand with bowel cancer, someone with bowel cancer, and the doctor goes, "Oh no, you don't have to worry about that."
Yeah, same. And I've heard a dietitian tell a cancer patient once they got out of the hospital, doesn't matter what you eat, you just need, it's all about calories. You can eat cheeseburgers and Coke and thick shakes. And I'm like,
I don't even understand that.
I don't understand it either, because
you've only got to watch a kid who's been on a sugar high to know that what you take in directly affects what's going on.
When we think about diet, we know that nutrients are the building blocks of all of our cells. Of course, nutrition's important. Yeah. And then thinking about microbiome and how much it's related to our immune response, of course, microbiome is important as well. Yeah. Our diet is the biggest contributor to our health of our microbiome. So, it's just, we know this.
And I think what I'd like to add here, and just a little quote from Hippocrates, that let thy food be thy medicine and thy medicine be thy food, but also understand, and this is where Jodie and I are coming from here, and please understand, this has nothing to do with doctors not wanting to help and heal, but we're really coming from a very strong integrated approach: mind, body, emotions, lifestyle. And so, you know, if a doctor says to you this information, remembering that if an oncologist is not necessarily trained in nutrition, is not necessarily trained in understanding microbiome, because they can't cover everything. So, you know, this is why we're sharing this video, because it's saying integrate. These key factors are going to make such a big difference in supporting your journey to potential well-being and healing. So, you know, I always say get a second opinion. I always believe in that. So, you know, if your doctor has said, well, that's not necessary, you know, potentially ask back to them and say, well, what do you know about my gut microbiome? What have you studied? Because this is how this is about empowering you to take your health back, to know that there is things that you can do based on knowledge to support you. So, because I get worried that if a doctor,
everyone's got a role, you know, like we need the oncologists and we need the specialists and we need their capacity to do testing and find out what's going on. But yeah, absolutely, I'm a huge fan of that whole integrated medicine model. I think it's the only model that's actually going to serve us moving forward as far as medicine goes, because we need to move past that, you know, that the way medicine's been set up, because our healthcare system is an acute care model, and now we're dealing with conditions like this, which is chronic care problems, you know, chronic conditions. Cancer is a chronic inflammatory condition or an immune issue, you know, it's not an acute condition, you know, like, so we need to get a better model. And integrated is got to be the way forward. So yeah, huge fan of that.
And can I ask a question? Obviously cancer, Sonja and I talk about cancer as being a build-up of cells in the body. So, and you know, it's well known, it's well documented that there are people who really can overcome these things, some with mainstream treatment, but people can overcome it in other ways as well. But part of the body's ability to be able to do that is literally to be able to remove excess tissue from the body. So from your perspective, how important is the microbiome microbiome, I think I said it wrong, in being able to do that, like to actually help take away the tissue that we no longer need anymore?
Yeah, well, I guess there's that feedback again. The two main elimination, or three main elimination pathways is out the bowels, like liver processing, and then out the bowels, and that's like excess tissue and old cells and dead cells, and then also the lymphatic system. And so the, you know, like where our immune cells that are involved in the lymphatic system to actually get rid of that excess tissue and old cells that don't need to be there. And then obviously the urinary system as well, which is another major elimination organ. So, you know, the microbiome is so related to the holistic health of all of those systems that if that's out, you've got inflammation, or if you've got excess inflammation coming from your gut microbiome, and now we're going to get rid of all of those, the toxins or the excess tissue or the old cells, or the, you know, like, it's just your elimination is going to be really clogged up. So it's it definitely has a huge role in that as well.
That's huge. Yeah,
thank
you.
Yeah, love it. Now it just, now that I get this and understand this, it's actually got my little head.
Yeah, I know. I'm the same. I'm thinking how it just ties in with everything so well.
Yeah. I would just like to ask, how does stress affect the gut microbiome? Explicitly, how does stress affect it? Because clearly we're living in a very highly stressed lifestyle these days. It's no surprise that probably 8 out of 10 people are experiencing chronic stress too. We're not talking acute here. How does that directly affect the gut microbiome?
Okay, so there's a few mechanisms that are happening when you're in stress response. Obviously, you're in fight or flight response, so that's in a survival mechanism. So in those times of fight or fight, your digestive system is closed down, so that whole pathway in the digestive system is not essential for survival. So it does things like changes motility, so it stops the normal motility of the gut, and that is something that actually has a cleansing wave that clears out build up old cells and, you know, like and the bacteria that shouldn't get there. So we have this thing called the migrating motor complex, which is a natural wave that comes through in absence of food. So it's actually between the food to clear out, and that stops when you're in stress response. So chronic stress, actually, we see people with this migrating motor complex issue. So you can get a build up microbiome or the wrong bacteria into the small intestine, which is, there's only supposed to be a little bit in the small intestine. Most of it's supposed to live in the large bowel. So we can get this build up in the small intestine. It changes the digestive secretions when you're in stress response. So again, that's changing the environment of the gut in which bugs are going to thrive or survive. It changes the pH. So the pH is closely monitored all the way, you know, regulated all the way through the digestive system, and that pH of the mouth is different to the stomach, to the small intestine, the large bowel, changes that. Our stress hormones like cortisol and adrenaline and noradrenaline change the pH in the gut as well. So any of these things that change the environment is going to impact the bugs directly, and then that's going to then feed back into that inflammatory response and the health of the, you know, integrity of the membrane layer and all those kind of things. Does that explain it?
Yeah, and that just re-emphasizes again that two-pronged approach, because it would be all well and good to be doing the gut microbiome health focus, but if you're in a state of high stress all the time, then that's sort of counteracting the good work you're doing with the digestive stuff, that they're supporting that. But in the same breath, flip it the other way, and
it's
I guess having it. Yes, yeah. So it's
stress
really,
affects it. Stress affects it, and then it affects how you handle stress.
Yeah,
you can't really do one without the other. Like I've had clients that have got really stressful jobs that we've had to change.
Yeah.
If that's impacting your health like that, because taking a probiotic or eating a plant-based diet is not going to alleviate that kind of stress. Like, we're not supposed to live with that kind of stress. It
not
is physiologically, not just the gut. Those things were just the gut. You guys know about all the other stuff, you know, the, you know, increased heart rate, increased, you know, everything that happens. It's every organ is impacted by the stress response. We're only supposed to have little bits of it, and then we go back into parasympathetic, rest and digest, sit under a tree, run away from the tiger, go sit under a tree and make some food or something. You know, like we're still that genetic structure.
Primal. Yeah.
We're fancy apes. Not much has changed, you know, so we still have that stress response, and our lifestyle is so different, you know. And then you think about, you know, toxins and all that kind of stuff, which are also a stress. So we're just under stress all the time. So massive impacts.
Oh, thanks, Sam. Is there anything else that you wanted to add, or any final words for, I guess, action step, you know, that any little words of wisdom that you really want to make sure that people get?
I would love to say, if people do have indications of having issues with their microbiome, so I'm a bit of a believer that any disease going on in your body has got a core of something going on in your gut, you know. But if you've got obvious things like digestive issues, you know, like bloating, food reactions, but also things like, you know, skin eczemas, and, you know, like that's an indication that you've got issues in your gut. Brain stuff, that gut-brain connection, so poor cognition, poor memory, foggy brain, you know, fungal things like candida. We didn't even talk about candida, but that's what we call that the microbiome. So that's the fungal part of the microbiome, and that's very often imbalanced as well. So any of these kind of things presenting, then that's a risk factor for getting one of these chronic disease conditions, and absolutely cancer. We know that dysbiosis in the bowel is related to colorectal cancer, you know, and other things like that. We know drugs like protein pump inhibitors, which are very common, they're the acid reflux drugs. So what they actually do, so, you know, so we said before, the pH of the gut, we're supposed to have a very acidic stomach, and one of those roles is to kill pathogens coming in this way. They would get into the gut and be killed. So when people are on long-term acid suppressants, the pathogens get through and then colonize in the small intestine and the large bowel. Or we swallow oral bacteria that would normally be killed in the bowel, in the stomach, and it's getting through and colonizing in the small and the large bowel. That's also a risk factor for colorectal cancer and other inflammatory processes.
Stomach as well?
Yeah,
wow.
Yeah. So the protein pump inhibitors are, the drug itself is only ever supposed to be taken for 12 weeks at a time, like it's for acute management. And we've got people out there on, was for 10 to 20 years, clients all the time that have, you know, and sometimes they don't even know why they're on it. I had a guy the other day, an elderly guy. Are we allowed to talk about cases? Am I running over time? This is really interesting.
This is interesting. I like this.
Yeah, really interesting case. And he had a heart attack 10 years before, and then he had a stress response when he thought he was getting a heart attack, and he was getting pain. And it wasn't acid reflux, because I questioned him at length about it, and he was getting a stress response. He was getting anxiety, but he reported it as a pain feeling here. So they gave him an acid inhibitor, and he was on it for the next 10 years, and he didn't even know why. And when I questioned him about it, and I said, what happened when you stopped taking it? And he went away. And he goes, oh, nothing really. So it wasn't for his digestion or any of those reasons. He'd been put on it back then and was still on it. Now, he came to me with increased infections in his small intestine and large intestine. He was getting these really severe food poisoning episodes. And so what we worked out is he had this really dysregulated microbiome in his small intestine and large bowel, and he was really sensitive to any kind of infection, and he was being hospitalized repeatedly for these infections and getting more antibiotics, you know, and more. Yeah, so we worked on his microbiome, got him off that one straight away. He didn't even need to be on it, you know, and now he's awesome. So he's, you know, we used some prebiotics and some probiotics and some diet changes, and we didn't need to do much. He was, you know, elderly, 70. He was a real risk for getting bowel cancer or some other kind of disease from taking that medication. And we swapped from that to some healthy diet changes, pre and probiotics, and he's gone from inflammation, no acid, you know, to a healthy digestive system. His risk factors have, you know, completely 180'd.
Yeah.
And I guess just allowing the body to do its job properly, really, isn't it? Like having a healthy microbiome is really what we're naturally born with, and it's got a really important role. So, you know, what you were able to do for that client, Emma, was exactly that. I guess re-establish it so his body can do what it's naturally designed to do, which is
absolutely
help him be healthy.
Fermented foods as well is something I should.
Yes. Yeah, I wondered about that. Yeah,
they're very much a part of a healthy, balanced, healthy microbiome diet. As a therapy, when I'm working with people, I would use specific strains of probiotics first at specific doses, and then we will include the fermented foods as a maintenance tool. So when we first learned about fermented foods, we were getting it from the people that were in the blue zones, you know, they had the best longevity. So it was because they were eating these, you know, probiotic rich foods every day on a daily basis. So we've got, you know, yogurt, kombucha, kefirs, sauerkrauts, fermented veggies. They're super easy to make yourself. So it's YouTube it. Yeah. So definitely getting some of them in is good.
Amazing.
This has been
Thank
so
you,
good.
Emma.
Yeah, no worries. Thanks for having me on. That's cool.
Yeah, and look, if people want to find you, obviously we'll be tagging you in this video, and they can find you and, you know, connect with you, or if they're not available to get to you, here in New Zealand, I could suggest some naturopaths and nutritionists here. But we really appreciate your time. This information has blown me away now, because it gives me and Jodie now more tools to then go when we work with our clients to say, hey, are you doing this? So, and for anyone, I don't think even cancer related, this is something we all needed to hear today.
Everyone needs to do it. Like there's no one, unless you're in the Hadza tribe in Africa, your microbiome is compromised. If you're living in this modern world, then your microbiome is compromised to some extent. And there's not many people that have never had antibiotics either, you know, like so. And we know that some of those strains in the diversity of the microbiome just don't come back, even after one course of antibiotics. So if you have repetitive courses or lots of different antibiotics, if you're a C-section delivery, you weren't breastfed, that kind of stuff, then you've 100% need to do some work on your microbiome as a preventative measure. Yeah.
Makes me realise what I've got to do for my family.
Same. I'm going to get my prebiotics.
I'll be in touch, Emma.
Yeah.
Yeah,
absolutely. Awesome. Well, thank you so just to finish this, so thank you to everyone who watches this. Please share this video. This is the information we want to get out there. Next episode, Jodie and I are going to go into more of the stress, emotional beliefs aspects of the causes of cancer, looking at how that affects you and giving you some actual specific root cause and examples of some cancers, including lung and breast, which we thought would be timely with what's been going on in the world at the moment with that virus thing. So tune in for the next one. Otherwise, from myself and the lovely ladies, thank you so much.
Thanks for having me.
Thank you.
Appreciate it.